we are going to be talking about the importance of seeing your gynecologist and what a gynecologist is. So let's first start off by talking, wow, I can't. Let me get my words together. How about we do that? So let's talk about what an obstetrician and what a gynecologist is, just because I feel like a lot of people don't know the difference or misconstrue what these titles are.
Who is a gynecologist?
Gynecologist is a doctor who take care or look after a female reproductive system.
Who is a gynecologist?
They are people finding in the house.
Hey! The gynecologist.
It's a person. It's a person who sells something.
Something like
tomatoes, onions,
bread.
Yeah.
So let's just talk about them. So an obstetrician is a physician that is specialized in anything to do with gestation, pregnancy, mother and baby, things like that. Gynecologist is a person or physician that is specialized in all things reproductive system for women, women's health, things like that. Usually physicians are OBGYNs. It's one position, but the specialties are different. So when you're going to go see your OB, you're talking or relating things to pregnancy. Anything to do with baby, pregnancy, you're saying OB. When you're doing about like gynecology, vaginal issues, possible breast issues, uterine issues, those are all gynecologists. But like I said, these doctors are the same thing. But the difference is, if you're saying I'm going for my OB appointment means pregnancy. Gyne appointment means vagina, breast, uterus, things like that. I'm glad we cleared that up. Okay, so why is it important for you to see a gynecologist? A gynecologist is a physician that is specialized in women's health. So they have all of the answers, or most of them have some type of answer or can get you an answer as to what's going on in your body because they are specialized in that field. So what that means is, for anytime you have like a yeast infection, a bacterial infection, any type of nodules or cysts on your breast, or you have things that are just abnormally happening to you, like say if you have something, a popular thing that I saw is hirsutism, which is like if you have like a bunch of hair on your face, or it's basically something that's characterized by excess androgens, which is testosterone, the male hormone, and like that feature, it's characterized, let me slow down, characterized by male attributes. So they're usually like kind of hairy and like bigger. So things like that is what you would see a gynecologist for. So the reason why you should see a gynecologist annually once you are 21 is to do your annual pap smear. So the gynecologist is not the most comfortable. It's definitely not the most sought after place. Definitely not the most popular or fun place to go, but it is needed. And so if you have never had an annual pap smear, listen up, honey, because I'm going to give you the first scoop and insight on what you can expect when you go in. When you go in, you're going to have to take off all of your clothes. It's a very intimate experience, very intimate. I love it. They should treat you to dinner after, but they don't. And once you are unrobed and unveiled all of your goodies, the doctor will come in, and by this time they've already discussed with you like your medical history, why you came in, blah blah blah. And at this point, 2 or 3 people have already asked you the same question. Let's be real, they ask the same thing all like as if they're not listening, but they're just documenting, whatever. So the doctor comes in, or a lot of times what's happening now is you're either seeing a physician, or you're seeing a physician assistant, or you're seeing a nurse practitioner. They are all qualified to do the same thing, so don't get your panties in a wad when you can't see the physician. Okay, I'm glad we had that discussion. Unless you're having a problem visit and you want to see a physician, then I understand, but not for annual pap smear. Anyway, so you go in and you're laying down. They're going to do your breast exam. And so your breast exam, they are basically checking to make sure just the health of your breast. So they're looking for to make sure you don't have any cysts in your breast, any lumps, bumps, nodules, things like that, any possible hint at a tumor, whether it's benign or malignant. Benign, if you're not familiar, means that it is non-cancerous. Malignant means that it is cancerous. So they're able to feel around and see and make sure everything's good. They're also able to tell like if you have fibrocystic breast or if you have heavy breast. But this is just all through speculation of what they're feeling, of what it feels like. But if they are suspecting something like fibrocystic dense breast or tumors or things like that, they are going to refer you to mammography, which is basically to get an ultrasound of your breast to make sure, to make sure that everything is tip top. And you'll go from there, and then you'll follow up with either the radiologist or your women's health provider. And so after they do the wonderful breast exam and they've kind of subjected it to that feely touchy moment, they're going to go down to your nether regions. Now you are on literally like widespread open eagle, legs are up, nothing is hiding at this point, like you are open to them. They do have a sheet on you for modesty. So like if somebody does walk into the room, like there is a sheet on top of you so that like not everybody can see your goodies. And what they're going to do is if they're a good provider, they're going to keep you at ease. Because like obviously your spread eagle like this is uncomfortable. You don't know them like that. And they're going to try to tell you like calm down, relax. Now, this is easier said than done, because if you're not familiar with your provider, you're not comfortable with them for whatever reason, you are going to be tense and you are not going to be the most comfortable. But the more tense and the more uncomfortable you are, the more uncomfortable it will be. Relax. Oh my God, it does not hurt. Okay. So after they have you in spread eagle, they're going to try to calm you, blah, blah, blah. And they're going to go in with the speculum. So the speculum is basically what they use to like, there's usually like a light on the speculum too. And it's like, I wish I had like something to like mirror it, but whatever. They go in, it's basically to kind of to open up a little bit so they can go in and swipe cells off of your cervix. And so either the speculum can be plastic or it can be metal. But when they're putting the speculum into, they usually put some type of surgery lube, which is like lubrication. So it's kind of similar to if you're using like lube for sexual intercourse. It's very similar, except it's like surgery lube, it's medical lubrication, whatever. It's the same stuff. And so they put it on there so for ease, so that if you are like super tight and tense, they can still get in. And then if it's metal, it might be a little cold for you. So just brace yourself for that. Ooh. But then what they're gonna do is kind of open it up a little bit so they can fully get into, so they can see your cervix. And at this time, like I said, they're gonna go in and swipe your cervix to make sure, and what they're doing is basically getting cells off your cervix. They can also go on in and swipe if you have any discharge or anything. If they're in there and they see anything that looks kind of funny, they're gonna go ahead and swipe what's on the vaginal walls as well and pull it out. So during this time, it's important for you to be like, just breathe, because it is not comfortable. Jesus! But it does not hurt. Now, if you are tense and you're like, some people like will try to jump off the bed like, ah! But you have to just breathe in and out. And I think when you know what's coming, you can kind of like brace yourself for it. So now that I've told you, hopefully like at your next appointment, you'll be prepared. But it does not hurt, it's just uncomfortable. But now for different vagina types, it might be more painful, or depending on like if you're sexually active versus non-sexually active, that's where pain might come in, or more uncomfortableness, whether versus if you've had children, if you haven't had children. And then so what they're going to do with those cells is basically take those cells and put them in a little tube. Those tubes are going to go off to a lab, and the lab is going to test them to make sure that you do not have HPV. And HPV is basically a virus called human papillomavirus. And if you want to know more about that, we can do a video on that. But they're testing it for HPV to make sure you're good. And then they're also making sure that you don't have any, usually for women under 27, they always test for gonorrhea and chlamydia, just because that's a disease that's popular in the younger age range. They're also testing for like different yeast infections, bacterial infections, or just abnormal bacteria that's present in the vagina. So they can get rid of it. And as well as if you ask, they will do STD testing. So the STD testing, all they can do via a vaginal swab would be chlamydia and gonorrhea and trichomonas. Chlamydia, gonorrhea, trichomonas. And then if you want like a full STD panel, that is done via blood work. So they will have to take vials of blood from you. And the full STD panel is HIV, HSV 1 and 2. HSV means herpes simplex virus. So HSV 1 is usually like cold sores, blisters, things like that. And the HSV 2 is the actual like herpes, like genital warts, things like that. Both are still a part of the herpes simplex. And then they also do syphilis. What else is on there? I haven't looked at that panel in a minute. All the STDs. All you can think of is on there. And they test it for you, and then it typically comes back and they'll call you with the results, or they'll have you come in for the results depending on what the results say. So other reasons why it's important for you to go into the doctor annually is sometimes, I remember when I worked at the doctor's office, we would find like people didn't know they were pregnant and they came in for an ultrasound just for a routine check and they found out they were pregnant. Or people, you know, you think your partner is faithful and they're not, and you come in for just a basic annual exam and you decide to do an STD panel and you find out you have an STD or STI, there's a difference. We can also have a conversation about that. But you find out that you have something and you would have never known if you would have waited more than a year or waited till you have some type of symptom, because sometimes some diseases are asymptomatic. So it's just important to have good health. These are some reasons why you should go see your gynecologist annually. And if you are 16 or like under 21, it's still a good idea for you to go and just develop a relationship, whether some people are on birth control and things like that. But just develop a relationship with your gynecologist and find one that suits you best and that is most comfortable for you to go visit. But that's all that I really have, you guys. We covered a lot of topics in here. I know some ideas might be new, might be a reminder, whatever the case may be. So because this was so much in one little video, I will be doing another video, and my next video will be about what do we want to talk about? I don't know, to be honest. I guess we can do you know what, the next video we're going to talk about is STI versus STD. And then we'll dive into some more, since we ended on talking about like the swab, vaginal swab and blood work. We'll talk about the difference between what an STI is, what they are, and what an STD is and what they are. So this has been a blast, a true slice. But I will catch you guys on the flip side. Happy quarantining.